I'm Zama Buthelezi. Welcome to this week's edition of Health Talk. Today is day 86 of South Africa's national lockdown and day 20 of level 3 in response to the COVID-19 global pandemic. So what's coming up on the program today? We'll be joined by a clinical psychologist to speak to us about the impact of stigmatization on communities during the COVID-19 pandemic. We also speak to the Chief Executive Officer of Charlotte Maxeke Johannesburg Academic Hospital about how hospital procedures have changed during the coronavirus pandemic. That's still to come, but first let's take a look at the latest South African COVID-19 numbers. One 1,260,434 tests have been conducted in South Africa. 87,715 people are positive. Recoveries, we're standing at 47,825, and sadly 1,831 people have since passed on because of the COVID-19 pandemic. Active cases, we're standing at 38,059. According to Health Minister Dr. Zweli Mkhize, COVID numbers are set to rise. Let's listen to the minister.
For the next many days, we are going to be seeing the rising numbers of new positive cases. For the next many days, we are going to see the rising numbers of people who are going to be hospitalized. We're going to be seeing many numbers of people who are going to be coming to the health centers, to the clinics, looking for assistance, needing to be assisted to get rid of the infection. We are going to be seeing many more people who might be losing their lives. We're going to be seeing many people who are going to be asked to leave their homes and join the isolation or quarantine venues where we would want them to stay away from contact with other humans so that we can reduce the spread of the infection.
Let's take a look at the provincial statistics update. Regrettably, 1,360 people have since passed on from COVID-19 in the Western Cape. And sadly, this province is also leading with the infection numbers at 48,706, followed by Gauteng at 17,261, with Eastern Cape at number 3 at 13,506. Let's continue with the provincial statistics. KwaZulu-Natal at 4,548, Northwest at 1,758, Free State at 658. Let's continue. Mpumalanga at 505, Limpopo at 503, Northern Cape at 218. While other people won't present symptoms of COVID-19, symptoms include fever, coughing, sneezing, and shortness of breath. If you believe there is a chance you may be infected, call ahead to seek medical help from your healthcare provider or use the public hotline 0800 029 999 and alert them to your symptoms. Wash your hands with soap regularly, use sanitizers with 70% alcohol content, and wear masks when leaving the house. Wash these masks with soap and water after use. Stay at home, and if you have to go out, observe social distancing all the time. This is just to make sure that we keep ourselves and others healthy and safe. So those are the statistics, but do remember that as we observe and report on COVID-19 cases, the numbers can change sometimes significantly. Remember, you can also be part of the show by asking our guest some of the questions on your mind, or you could simply share your views on what we are discussing. The number to call is 011-714-6841 or 6842. Stigma and discrimination around illnesses can lead to the risk of faster disease progression. Only by confronting stigma and discrimination will the fight against COVID-19 and other pandemics be won. Our question for you this week is, how can we destigmatize coronavirus disease? You can send your voice notes or video messages on our WhatsApp number 065 862 4548. Please keep your messages short, just under 30 seconds. You can also share your thoughts with us on social media via Twitter by using our hashtag at SABC Health Talk on our Facebook page, SABC Health Talk. Health Talk continues right after the break. Please stay with us.
Heroes define their own legacy. Some walk through smoke and flames. Others nurture our future leaders. Some bring order to our lives, bravely keeping us safe and secure. And some take risks and create opportunities. All these legacies started somewhere. Start your own legacy with Lyceum.
If there's one thing that we have learned from COVID-19 is that we are all in this together.
With everyone being affected with COVID-19, as a show that brings hope and inspiration to the marginalized, the team decided to lead from the front in such trying times.
If you are doing the little bit that you can with what you have, you can let us know on social media. Just use the hashtag StoriesUntold SABC. Alternatively, catch up with our shows on YouTube. You can search for Stories Untold SABC.
Norma, thank you so much for talking to us. You just went to visit your doctor for a script and you decided to do a COVID-19 test. Tell us, why did you feel it was important for you to do it?
A week prior to me visiting my doctor, I had experienced a mild cough. And I felt when I was there, it was important that I actually shared this with him because it one of the symptoms for COVID-19. So then my doctor continued with other checks where he checked my temperature, he then checked my blood pressure, and everything to him was fine. And he wondered why I wanted to go for this test. And I said, I feel because it's one of the symptoms, I would just like to know. So he did send me to the nearest lab where I tested on a Monday. And the Wednesday morning, he then called me to tell me that my tests have come back positive.
Tell me about self-isolation. You are in the Western Cape at the epicenter of the virus. You are alone in a complex. How did that impact on you? What were you doing while you were in isolation? Were you taking medication? Did he give you medication to take? What were you doing?
When we were having the conversation where he was telling me that I had tested positive, I then asked him what he was going to give me. And he said, you don't have any symptoms. There's nothing to treat. So in the absence of you having symptoms, you then allow your body to fight the virus off, which seemed a bit odd for me because, I had seen all these ideas from people on social media, things that I had read on. And I thought, but why is he saying that I mustn't take anything? So I then took a whole lot of things. In the morning, I would make this concoction that is made up of garlic, ginger, pineapple, or oranges, where I drink to start boosting my immune system.
When did you decide to disclose, and who did you disclose to?
On the Wednesday morning, after my doctor called me, I then sent a text message to my sister, who would then tell my parents that I had tested positive. My dad called me probably an hour or two later, and surprisingly, my father wasn't in a panic at all. He said, you know what? If you're feeling okay, I'm grateful for that. You're healthy, you're strong, you will fight this. And it's not a death sentence. I think that was probably the first time I actually broke down since hearing the news from my doctor. I think just hearing somebody who, cares, somebody, who themselves is probably scared. I got a bit emotional and I cried about it. But straight after that, I then sent an email to my workplace, because as much as I was working from home, I was going to the office on the odd occasion. So I was exposed to a number of people. Of course, we were practicing social distancing and all of that, but it was important that I do let them know that I have tested positive. I also sent an email to my body corporate, because I live in an estate, and that means that there are other people around me. Soon, probably in about an hour, my body corporate then sent a team to come and fog or fumigate around my place so that other people were not at risk.
It's more than 14 days you've been cleared, but psychologically being isolated and going through this alone, it must have had an impact on you, Nomawethu. What was going through your mind and how are you feeling now?
Self-isolation, I'm not going to lie, for me was horrible. Yesterday, for the first time, I went running again. So I left the complex, and for the first time, I saw one of the security guards would have to get stuff to my place that was delivered by other people, either online stuff or friends that were dropping things off. And I thanked him for his bravery. And I was honest with him that if I had to be you on the other side, where I had to go and sort of interact or go to a place where I knew for sure this person had tested positive, this would have been very difficult for me. But I must say the support and everyone around me was magnificent, and it really carried me throughout the 4 days.
Noma, I'm happy you're okay, and thank you so much for the interview. All the best. I know you're very active, so you're going to go back to your old routine and live your life. Thank you so much for the interview. Much appreciated. Well, that was the interview I did with a former journalist from the Western Cape, Nomawethu Solwandle. Presenting the march talked about symptoms of COVID-19, and finding out that you are infected by the virus could have a huge impact on a person's mental health. It could even be worse to those who are living with mental illnesses like depression, anxiety, and fear of stigmatization could see many avoiding being tested and disclosing, thus putting millions in danger of infection. To delve deeper into stigmatization and discrimination of people infected and affected by COVID-19, we welcome clinical psychologist Charity Mkone. Good morning, Charity, and welcome to Health Talk.
Good morning. Thank you very much for having me.
Talk to us about this term stigma. What is stigma? Are there different kinds of stigma? How does it happen?
I think in the context of the COVID-19 pandemic, there is a social stigma going on because this is a disease or something that is affecting people globally. So a mass number of people at the same time. So people who might be having symptoms of COVID-19 or testing positive for the illness will experience what we call a social stigma. And there will be labels and forms of discrimination that are given or that are shown towards people who have that stigma because of the fear that other people have of the disease and what it comes with.
COVID-19 doesn't just affect South Africans or women or men, it affects us all over the world. Is it something that we should be ashamed of as people?
I mean, you're quite correct in saying that it doesn't discriminate. And I think what makes it so difficult and what fuels the stigmatization is the levels of unknown about the novelty or the novelness of the illness. Because it's something that's new, it's something that has swept through the globe. All over the world, it is something that is quite anxiety-provoking for a lot of people. And naturally, as human beings, if there are a lot of unknowns or things that we don't know or things that are new to us, we naturally, and very understandably so, begin to respond in a panicked or very anxiety-stricken way. And I think that is the difficulty with it, that there's no, in a sense, there's no way that you could run to feel like you're safe from the virus, because the whole world, so globally, everyone is affected by it. So what happens then is that the natural thing or the natural instinct for human beings is to then isolate. That is the physical isolation and the quarantine, which is helpful for health and the transmission of the virus, but also emotionally and psychologically isolating people who might display symptoms of the virus or have the virus in order to feel that we are safe. And I think that level of social stigmatization, where there's the us and them between people who have the virus or have symptoms of the virus, are treated very differently and spoken about very differently to people who might not have the virus. And I think that is the social stigmatization that really, unfortunately, has negative impacts on the care that people are able to receive if they are transmitting, if they have symptoms of the virus, or even if they test positive for the virus. And I think the social isolation of groups of people who might have this illness comes with very dire consequences, both on their mental health and well-being, as well as their standing in society or how they see themselves. And those symptoms or those challenges with mental health, social standing, and how other people view them live way longer even after you test negative. So the psychological effects of the pandemic and of the virus are so much more long-standing than the virus itself. And that's the difficulty, particularly with stigmatization. So it is important that we have certain steps and do's and don'ts. And I do think there are do's and don'ts to try and minimize as much as possible the stigmatization around the disease or around the virus.
Charity, from our conversation now, I'm thinking about how we are now self-stigmatizing. I'm very active on Facebook, and every year around this time, I'll be posting, and my friends will be posting about how we are down with flu, post concoctions, mix this and this, it has helped me. People will take pictures of their medication, flu medication. Another person will say, I've just had my vaccine for flu, but this year it's quiet. But what's the impact of self-stigmatization? Because it's quiet, we're not posting at all about flu.
I think you're bringing in a very important aspect of what fuels stigmatization, either social stigmatization or people stigmatizing themselves, and that's social media. And as much as social media can be and is, for the large part, a very effective way of passing on and transmitting messages and information, it can also be a source of the actual stigma, because there's a lot of panic that can be put out there because of misinformation. And I think the case in point was Noma, in terms of how she experienced her symptoms and how, or no symptoms at all actually, but still tested positive. But the panic and the fear was fueled by messages on social media, perhaps certain things that the media was saying. So in terms of coming back to the do's and don'ts of staying away from social stigmatization or stigmatizing, is to really speak about factual cases and facts around the pandemic and things that will actually help people to know how to respond or to act. And I think the self-stigmatization comes as a result of people feeling ashamed that in a case where you just have the seasonal flu, like you're saying, that people have every year, it immediately, because of the panic and the fear of the virus, people will associate it with having positive symptoms. And then what that does is cause them to isolate themselves in terms of not keeping the information to themselves, not disclosing, and in some cases not even receiving the proper treatment, because people feel that now that they know, now that they're having symptoms of the virus, it will be very difficult for how people will view them or how people might say or act towards them. So I think stigmatization is not something to be taken lightly, because it does impact people who are affected in sometimes very negative ways, and can actually be part of the cause of what spreads the virus. So I think it's important, the languaging that we use. So the words that we use to talk about, to explain, and to discuss matters around the virus are very important. Okay, so things like talking about people who have COVID-19 or people who are victims of COVID-19 or COVID-19 cases. All those things and the type of language that we use around that is fueled with stigma. So something that would be helpful in speaking about it would be people who may have COVID-19, is to say suspects. COVID-19 suspects, people who are having symptoms of COVID-19. Because the difficulty with stigma is that if the person does not separate themselves from the virus, so it's someone who has COVID-19 as opposed to someone who is suspected to be displaying COVID-19 symptoms, suspected to have tested positive for COVID-19, that makes it very different. That the person can feel like this is something that is not caused by them. And I think that language of criminalizing someone for having it, that you are a transmitter of COVID-19. And I think that's the difficult part, where the language that we use fuels the stigma, because people then feel very guilty, as though it's an intentional thing, as though it's something that they are doing to other people or doing to society. So it is very important, the language that we use, particularly on platforms such as media, as well as social media, because those are the places that have masses of audiences. And when messages are received from those platforms, it's important that it reduces people's panic, that it doesn't minimize the impact of the virus, but really reduces people's panic in the way in which the pandemic and the disease is spoken about, so that the people who are affected, either their loved ones or them themselves, people who test positive, don't feel like there's something wrong that they've done or there's something criminal about them. So I think speaking in very humane ways and not dehumanizing someone and calling it, some people I've seen call it the apocalypse or the plague. And there have been movies and documentaries and things around the virus that has really also played a role in fueling some of the stigmatization and unnecessary fear on other people. And that has very negative consequences to people who might have contracted COVID-19 and people who might have the symptoms and actually don't have the COVID-19 virus.
Charity, when you look at the case of Nomawethu Solwandle, she's active, she's young, she runs marathons. It shows that anyone can be affected by the virus. But I'm just looking at where we come from as a country. This thing of stigmatization is not new. At the early stages of HIV, people were stigmatized. Those who were infected, even their children as well as families. Do you think enough has been done to educate people about how to treat others who are infected and affected by the pandemics? This has happened with TB as well, which can affect anyone, but it has been associated with HIV. So people are even scared to say, I have TB, because they will be labeled. So do you think enough is being done to educate our society about these pandemics?
Looking back at the history of communicable diseases and how diseases that in the past were from one person to another have been looked at and treated, particularly in our context. So if you look at something like HIV.
Okay, we having line issues. We're just going to go to break. Please stay with us.
We have all come from somewhere, been shaped and molded by our experiences. And I've learned the value of hard work and determination. There have been some highs and a couple of lows. But here I am today, successful, thanks to Ugogo and Damlin.
Sinalanga ndifit Daniel Makwava from Shawela. So as ndiko show ma security ndingapha awuchi that zikolo za SABC zikodolugisiwa ndaba na interest yore ezithu zo ndi Jeneka radio ndingazwitisana. Then ndatangana na this guy over technician yawone SABC na yambutso no mfethu thomani ngazituku then ni doura ni swike somewhere. Today ndiko run an online radio station which is called Shawela Radio to make difference and to bring change ka community yasho.
Why is it important for the public to get involved in this discussion?
Virtually all municipalities are putting in bids to have their salaries increased. Councillors and municipalities around the country are oblivious to the fact that there's a pandemic out there that has created economic havoc in this country.
How does SALGA respond to that?
There is no municipal that has asked for an increase. We have then said to councillors, a council will sit, look at the gazette that has been provided, and it provides an upper limit of 4% for this current financial year for public representatives.
We're trying to say to the municipalities is get in touch with reality. You cannot simply sit back and say it's business as usual.
Many of our councillors have taken that, and we have seen how they have made a contribution by responding to the clarion call of the President.
We're talking to clinical psychologist Charity Mukone. She's on the line from Johannesburg. We're talking about stigmatization of those who are infected and affected by the COVID-19 pandemic. Hello, Charity.
Hi, Zaman.
Hi. We were talking, Charity, I was saying to you, we have had these pandemics before. We have had stigmatization at the early stages of HIV, say here in South Africa, and we've had stigmatization of people who have TB being labeled as having HIV as well. Do you think enough is being done to educate our society about these pandemics and the issue of stigmatization?
I think you bring in a very important factor in terms of looking at history, because we can get a lot of information from histories of how we've treated communicable diseases such as HIV and TB in our nation. And I think very early on, and perhaps even right now, a lot of people who were infected or affected by HIV and AIDS, a lot of them died from the stigma. So people didn't want to go to their local health centers to receive the treatment because of how they'd be viewed, or because of the certain things, certain words that were given to HIV. And I think the social stigmatization was really high and prevented people from getting treatment. And same goes for illnesses such as TB, like you mentioned. So I think judging and going from that history of how communicable diseases and epidemics and pandemics have been treated and spoken about, particularly in a South African and African context, it goes to show that very little has been effective in being able to destigmatize as well as destigmatize the illness as well as humanize people who might be affected by these illnesses. And I think it is quite an important point to be able to labor on and speak about the social messages and how we speak about these diseases, to destigmatize them in order for people to be able to feel empowered to receive the proper treatment, to empower themselves with knowledge about the illnesses and the diseases, as well as know the facts about it, so that it's not something that leads to stigma, or it's not something that causes people to be in despair around the treatment and around how they will be received by their communities and the society around them. So I do think that the destigmatization is it's not just a nice thing to do or something that is suggestive, but actually quite important in fighting and combating these diseases and these particularly communicable illnesses, because it has dire consequences and really far-reaching consequences in terms of the stigma that goes with it.
Charity, let's talk about the issue of disclosure and stigma. Firstly, let me ask you, if I find out that I've tested positive for COVID-19, when should I disclose and to whom should I disclose to?
So I think the responsible thing to do is in terms of the contact tracing. So if you have been tested positive and think back on the places that you've been to, and I think something similar to what Nomawethu was speaking about, in terms of contacting the regular places that you had been to, letting people know that you share spaces with, in a complex, in a workplace, and as many people as you know personally. It is a responsibility to be able to let them know to try and reduce transmission and get those people to see whether they've been impacted or not. So I do think that in terms of taking responsibility for the health of others and the people around you, it's important to inform people who may be impacted, who may have come into physical contact with you. And I do think that also receiving support on a very emotional and psychological level from family members and loved ones is also quite important. But that support from family members and loved ones needs to come from them having more information and actually having facts around the illness, how to reduce transmission and how it can be treated, and like all the medical and scientific facts that we already do know about the virus.
Charity, thank you so much for talking to us this morning. That was clinical psychologist Charity Mukone. Stigma and discrimination around illnesses can lead to the risk of faster disease progression. Only by confronting stigma and discrimination will the fight against COVID-19 and other pandemics be won. Our question for you this week is, how can we destigmatize coronavirus disease? You can send us your voice notes or video call us on 065-862-4548. You can also share your thoughts with us on social media via Twitter using @SABC Health Talk. After the break, we speak to the Chief Executive Officer of Charlotte Maxeke Johannesburg Academic Hospital, Gladys Bohoshi. Please stay with us.
It's our mandate as SABC News to bring you factual and accurate coverage amid the COVID-19 pandemic. And from the Northern Cape, we'll keep you up to date with all the latest. Remember to wash your hands with soap and water for at least 20 seconds. Alternatively, use alcohol-based sanitizer and don't touch your face. The SABC is your reliable source for independent and impartial coverage. Make sure you use all SABC platforms and follow our reporters locally and abroad for all the news that matters.
Parcels are being prepared for the most vulnerable and needy. even those with money are holding on to their money. We don't know how long this is going to last.
Desperate community members in Mamelodi turned to the Baptist Church for relief.
We started with about 50 people from the community, and then the numbers got bigger and bigger.
This community has more than 6,000 residents. The mining sector only allowed 50% of their workforce.
We are still in the dust, we are still in poverty.
The miners are not helping us with anything. I'm so happy to have received food parcels because I have no income.
We live in a new high-tech environment. Because of technology, some of the world's wealthiest people are tech entrepreneurs. Tech is how we play and how we work. For your tech conversation, join me, Phumelele Zondi, on Network every Sunday at 8:30 p.m.
COVID-19 pandemic could result in permanent governance changes at hospitals. One of the hospitals that have made drastic changes is Charlotte Maxeke Academic Hospital in Johannesburg, which is a designated hospital for patients with COVID-19.
It ranges from a whole host of things. So where it affects patients directly, we've stopped visiting hours and visiting of patients unless the exceptional circumstances and the family or people wanting to visit have gotten prior permission. Obviously, if it's a child, we'll allow one parent with the child because we can't keep the children at hospital by themselves. Other instances where changes have been made are, for example, in the pharmacy, where people would have come to hospital on a monthly basis to collect repeat medication scripts. We're now trying to give them 2 or 3 or even 4 months of medication so that they don't have to keep coming back.
One of the procedures that needed to be halted due to COVID-19 was elective surgery. Prof. Motara explains why.
Things like our outpatient clinics, where patients would have come, for example, to high blood pressure clinic or to a diabetic clinic. Those have been curtailed to only allow real emergencies to come through.
The benefits of using telehealth technology in epidemics could help in the fight against COVID-19, but it seems to be difficult to implement at some hospitals.
In order to do it, the department has to put certain things in place, have the infrastructure, have the staff, have access to laptops and tablets and those kinds of things. And obviously that takes time and money. So I have no doubt that in the future and even going towards NHI that is the vision. I'm not sure that we'll be able to have it up and running immediately now for COVID.
Seeing that things may stay like this for a while, it is important for the public to know what to do when visiting a health facility.
The most important thing is if you're going out, make sure you have a mask on. Make sure that you touch as few surfaces as you come into contact with. So don't, touch and hold things unnecessarily because the virus does survive on surfaces. Obviously abide by the taxi occupancy rules and those kinds of things. And if you have to get to a hospital, access the health system at your nearest healthcare facility.
As the healthcare industry enters a period of major changes due to COVID-19, hospital administrators must prepare for a number of major challenges to ensure that procedures run smoothly. On the line to talk to us about some of these changes and new regulations at Charlotte Maxeke Academic Hospital, we are joined by Gladys Bokhoshi, who is the CEO at Charlotte Maxeke. Good morning, ma'am. How are you?
Good morning, and how are you? And good morning to the listeners.
Thank you so much for joining us. Charlotte Maxeke is one of the hospitals designated to treat COVID-19 patients. With stigma around this virus, how has it impacted on the numbers of people that you are seeing every day? Are you still seeing large numbers of people coming, or the numbers are dwindling?
No, thank you very much for the question. maybe let me give the context. Usually, Charlotte Maxeke sees about 1,800 patients that come through the hospital. About 800 of them are coming to collect their medication, while the other 800 are coming to visit the different clinics that we have, which is about 52 of them. Since COVID started, we have not actually seen the numbers going down, except for the patients who were supposed to be booked in for elective surgery. As you know, that with the regulations, we had to stop the elective surgery. And the reason for this is that Charlotte Maxeke is a highly specialized hospital. We see patients who are very, very sick, and therefore most of them cannot actually wait forever. If they do not come, we will have challenges. Where we saw a drop in number of patients coming in, it was in our casualties, because we try to screen you before you come in, and I think a lot of people were coming in due to the scare of the COVID-19. We did see a high drop with trauma, especially when the stage 5 lockdown was announced. But following stage 3, we are seeing trauma casualty slowly climbing up.
Gladys, how difficult it is to focus on COVID-19 as well as other illnesses that the country is grappling with. I'm talking your HIV, I'm talking your TB, cancer, people are doing chemotherapy and radiation. How difficult it is with the precautionary measures and regulations that have been put in place?
I must say that it is one of the most difficult and unprecedented pandemic that we have seen in a health system ever since I started working, and for many, many years, probably over a period of 100 years since France had that pandemic flu. We are dealing with a quadruple pandemic of lifestyle diseases. We have been dealing with a high trauma rate, and rightfully, as you say, the communicable diseases in terms of HIV and TB. And now this comes in. And I think one of the most difficult, especially during this time of the year, is that in June, that's where the flu pandemic also comes in. And therefore, people who are normally not coming to the hospital, we see them coming in now because of flu. And now the next one will be the COVID-19. But we are also seeing a lot of anxiety from a lot of people, especially when they hear in terms of saying that one of the relatives or family member is positive. Then we see a surge of many people who are coming into the hospital to try and get themselves tested or screened. The last one is a group of the industry, where if one of the staff members tests, they try to bring everybody. So our clinics are still functioning to a large extent the way they have been functioning. They still see close to up to 800 patients. Our wards are running at least 50%, maybe 50%, because the only ones that are not coming are the ones who have to come for elective surgery. But even still with elective surgery, if the condition of the patient is such that not doing anything now will lead to a catastrophic result, we still bring them in and we still operate them.
Gladys, we have seen an outcry from pregnant mothers who are not sure, who are worried about their safety when time to give birth comes. How can we assure them that these procedures, whether it's natural birth, whether they have to go through surgery to give birth, they are going to be safe at your hospital?
No, thank you for that question, and it's very, very important. In our hospital, every person who comes in through any entrance is screened, and if it's found that he or she has symptoms, she or she is sent to our casualty for further testing. But the second thing that we have done is that we have decided that everybody who needs admission, they will be admitted in a temporary ward where you are fully screened so that we are very sure that you are either positive or you are not positive. Because the way we treat the patients who are positive is different from, including the PPE that people have to wear. It's different from the person who does not have a COVID-19. So in all the areas of our hospital, including the same obstetrics and gynecology, when you come in, you will be admitted in a particular ward and the tests will be done. We have a very good understanding and relationship with our lab who try to really give us the results within 24 hours so that we know what we are dealing with. But the second thing is, especially with pregnant mothers, some of them come already fully dilated and you don't have time to actually go and do the test. So we have put the theaters in such a way that they are ready to deal with a person that could be positive, and therefore in that case we go into what we call a red zone. Everybody dresses up as if the patient is COVID-19, and the procedure is also performed in such a way that we make sure that the patient and the unborn baby and the health workers who will be working in that theater are safe. But what we also do immediately before and after that procedure, the theater is cleaned thoroughly according to the infection control and prevention method so that we prepare it for every patient who comes in. And regularly, because remember the infections that are in the hospital is not only COVID. We also have other types of infections that could be in the hospital. We regularly fog areas where we know that there are COVID patients. We fog regularly, sometimes 3 times a week. But where it is not a COVID area, which we call them yellow or red, we fog sometimes once a week, over and above a clinic. But lastly, the health workers, all of them, every morning, the heads of the departments are expected to do a pre-screening so that if there is anybody who's not well, she or he is not exposed in that area for the sake of herself and also for the sake of the patient.
Gladys, there has been concerns from parents who are not taking their children for scheduled vaccinations. Do you as a hospital have plans, because we don't want to see an outbreak of polio and measles in the near future? Do you have plans for those who have missed these scheduled vaccinations in the near future to have access to them?
No, thank you for that question. In fact, it's one of the things that is of worry to all of us. And I need to indicate that immunization does not happen at a hospital like Charlotte Maxeke, because we remember we are highly specialized. Immunization happens at all the clinics, and none of the clinics are closed. In fact, we are encouraging every parent to take their children for immunization. What is required when you go to the clinic is that they try to do a booking system so that you do not have too many people coming in at the same time, and also to allow social distancing. So if there is any parent who has missed their immunization of the child, please contact your local clinic so that they can tell you what day you should come and what time you should come, so that your child can be immunized as soon as possible. We do still do immunization at the hospital in the event a child or the mother is coming to the hospital. However, we encourage you to go to the clinic because that's where the immunization takes place.
Okay, besides the immunization, we've also read about a drop in patients who are on chronic medication like HIV, diabetes, hypertension, not visiting health centers across the country because of fear of the COVID-19 virus. Tell us, are you seeing those, and do you have plans maybe to contact them somehow and for them to have access to their treatment to avoid the worst pandemic that could happen?
We are really trying hard to ensure that everybody who comes to our hospital is as safe as we possibly can. Remember, I mentioned that everybody is screened, whether you come through parking day or you come through public transport. But when you get into the clinic, we do have sisters also who check on you before you are seen for whatever condition that you are coming in with the hospital. But also when you go to pharmacy, we have queue marshals who also look at social distancing and in fact continue with the treatment. So I urge everybody who's anywhere in the country to at least call the hospital so that you don't come on the wrong day. And the reason I'm mentioning the wrong day is that, for example, at Charlotte, due to the number of clinics that we have, we do not run, let's say, the hypertension clinic every day. You will find that maybe it runs on Tuesday or on Thursday. And therefore, when you phone, they will be telling you when to come. But most of the time, even if you come on the wrong day, we try to help you. The only problem with that is that then you will find it difficult to find your doctors, because on that day, when they are not running the clinic, they are doing other things like operations or they are in the wards and what have you. So we are really urging people to please come and fetch their medication. Please come for their appointments if it's important, unless the doctor calls you. In terms of medication, the Gauteng province has actually started a program called CCMDD. This program is trying to get people who are receiving medication and they are stable, it's chronic medication, that they go and collect it in their nearest chemist or ShopRite and what have you. So at Charlotte Maxeke, for example, we have started that program where we are trying to verify the address of the patient where you stay and ensuring that the medication that you need to get is on the program so that we minimize you coming to the hospital. Because if you have that, or if you are on this program, you will only be coming to the hospital once every 6 months to have your doctor review your script. But the last thing in terms of medication, the Pharmacy Council has actually allowed us to give more medication per month when the patient comes. Instead of giving you a 1 month supply, we try to give 3 months supply, sometimes even more than that, just so that we minimize the number of people who are visiting hospitals on a daily basis. And this applies to the whole country.
Cancer patients who are on chemotherapy and radiation have called on this show, since it's a health show, complaining about how they are not allowed to have their family members to hold their hands when they are taking their chemotherapy, and they need these people to be next to them. And some patients are now even saying it even takes longer for them to do their treatments and finish and go home. Just tell us about what happens at Charlotte Maxeke. Is it the same as the complaints we've been receiving? How are you dealing with this issue?
No, thank you for this question. It's very important. Remember, with the cancer patients, they fall under the high-risk patients. And therefore, every time you treat a cancer patient, the nurse or the doctor, there are certain items of PPE that they must change. So before I would come and greet you and start with the treatment or engaging you, nowadays I have to wash my hands in between seeing you. If I touch you or I have to do a procedure, I must take off the gloves in a particular way, go wash my hands, then don again the new pair of gloves to come and see a patient. So a patient who used to be seen for 15 minutes now takes 30 minutes, which means if you have 10 patients, you will double the time of how long you see those patients. That's the first thing. And therefore, that means that every time we see those 10 patients, if we did the clinic for 5 hours, it means it will take us for 10 hours. 10 hours. The second issue is that the reason why we are saying social distancing is important, and that goes to holding of hands. When we are talking like this, we all have a small split of our saliva around the area where we are. And this is how the COVID is transmitted. As your small droplets of saliva goes around the whole place, somebody, maybe your relative or a nurse or somebody else, touches that saliva. Once they touch the saliva and they put their hand to their mouth or to their eyes or to the nose, that's how you get transmission of COVID-19. We are requesting the community that social distancing should not only happen at the hospital, it must happen even in the home. We must try at home to ensure that we are sitting at least 1 meter away from each other, so that we try to minimize the infection. But the second thing is that we are requesting that everywhere in the house, people must wipe, wet wipe, tabletops, your telephones, your computers, everything, furniture, including the door handles. Because remember, if we are 10 in the house and all of us hold that door handle and we have the virus on our hands, everybody who goes through that door and goes and touches food or puts their hand on the mouth, they will end up getting the infection. So the social distancing is not only when you are coming for your oncology treatment, it must happen everywhere where we are. The other advice that I would really like to give is that we must try, for example, when we have your cell phone, keep the cell phone to yourself. Because remember, when you speak on your cell phone, there are those small spitting of saliva that goes onto it. So we must try to discourage people sharing a lot of things where this virus can actually land on, so that they try to minimize the infection. The other big problem is the remote controls. We all watch TV, and the children want to watch the children's show while the parents want to watch the news. One of the advice I can give is that one person must be in control of the remote controls. But in the event somebody has to take that remote control, we must clean it, and the easiest is just to mix water with a little bit of bleach or domestos, so that you can try and make sure that the virus is cleaned every time somebody touches these common items that we use in the house.
Gladys, thank you so much for taking part in our studio discussion. Thank you to our guests and our viewers for watching Health Talk. Don't forget, the only way to manage this pandemic is if we play safe and protect each other. Stay home, social distance, wash your hands and wear a mask when outdoors. I'm Zama Mutelezi. Do take care.